Our current understanding of the Hispanic Latino cardiovascular disease morbidity is clouded by the lack of representation in data about the health status of these populations. Patients who identify within the larger Hispanic Latino group are not homogeneous, and we need to do a much better job at understanding the uniqueness that exists within these subgroups. Differences between Hispanic subgroups are often more significant than between other racial ethnic groups. I'm a general and preventive cardiologist and health disparities researcher at Stanford University. My interest in eliminating inequities in care for diverse populations is very personal. I'm a first-generation Hispanic immigrant to the United States and have seen firsthand how quality of healthcare can be limited by social factors such as income and English language proficiency. My mother, a single parent and recent immigrant, was diagnosed with rheumatic heart disease at a young age that required open heart surgery. Since then, I've been committed to understanding the science and the pathophysiology of heart disease. My research group works to identify gaps in cardiovascular care for minority populations and seeks to develop innovative approaches to eliminate these disparities. In 2016, cardiovascular disease caused the deaths of over 27,000 Hispanic males and 24,000 females. Looking more closely into these numbers, there are subgroup differences that need to be acknowledged. For example, age is more strongly associated with the higher prevalence of dyslipidemia in Puerto Ricans, while high triglycerides are commonly seen in Central Americans. Providers and public health organizations need more information about how their patient populations are unique so that they can tailor their research, education, programs, and guidelines appropriately. The National Minority Cardiovascular Alliance is working to better understand the influence of genetics, cultural beliefs and behaviors, and socioeconomic status on cardiovascular health and disease. These important programs help me and my Alliance colleagues to deliver better care. As co-chair for the National Minority Cardiovascular Alliance, we are working to eliminate cardiovascular health disparities among 4 minority groups: African Americans, Hispanic Latinos, Asians and Pacific Islanders, and Native Americans. We are working to create a central space for diverse groups such as patient advocacy organizations, providers, researchers, government, and nonprofits to pursue meaningful dialogue and create inclusive solutions related to cardiovascular disease disparities facing minority groups. Our mission is to create positive change within the cardiovascular space and strengthen our members through shared purpose, deeper understanding, amplified voice, and expanded resources. We seek to partner with stakeholders like you across many sectors to advance critical work in this area. We welcome all minority cardiovascular stakeholders to join us. For more information on the National Minority Cardiovascular Alliance, please visit our website.